going to talk about people with major depression. That's very serious depression. One of the big issues with depressed people is suicidality. Actually, with all of these people, that's an issue. The manics, they're at risk for suicide when they're very agitated because it's a very uncomfortable feeling. It's a very uncomfortable feeling. They're wound up, they can't sleep, they can't think, and they seem to lose a sense of time, and that seems to add to them being suicidal. So we often think about that. The very depressed are often suicidal. That's, if you, as a police officer, if you find out that someone's feeling depressed, hopeless, helpless, and suicidal, you want to remember that suicide is a symptom and be able to tell the individual, sir, we can get help for you. This is going to pass, so let us help you. The depressed, they look depressed. They have slowed down, they'll look down, they won't look at you, they'll talk slow, they'll move slow, they'll look depressed. They'll talk depressed. They don't feel good, they feel down, they feel sad. And again, they'll even talk slow, move slow. We call that psychomotor retardation. Again, it's the opposite of the hyperbipolar. Most depressed people accept help, so they're probably maybe a little easier population to deal with in terms of seeing depressed people on the street. Treatment for depression, one of the most effective treatments is medications, antidepressants. There's a whole list of antidepressants. Today's world, Celexa is a common one, Lexapro is a common one, Remeron, a generic mirtazapine, an old one is Elavil. A lot of people take trazodone at night to help them sleep. Depressed people often have trouble sleeping. Cymbalta is a newer antidepressant. And most depressed patients know their medication pretty well. They tend to be shut down, low energy, and again, a lot of the symptoms of depression include hopelessness, helplessness. With depressed people, you more often than not, you can kind of just take over. They almost need that from someone. So if you see somebody shut down, you just say, come with me, we'll help you, we'll get you where you have to be. Just tell me a little bit more what's going on, but you can kind of almost just take over, and they may not say much at all. But then you watch them. Are they responding to you? And a depressed individual is going to be more likely to respond to you versus the psychotic. Some people who are very depressed are also psychotic. They'll be dealing with hallucinations. Usually they're auditory hallucinations, voices. Usually they're very derogatory voices that are very critical of the individual. So they look pretty damaged, pretty hurt. So back to medications, the schizophrenic patients take antipsychotics, and the bipolar patients take mood stabilizers, and of course the depressed patients take antidepressants. So you want to remember those groups, the antidepressants, the mood stabilizers, and the antipsychotics. With the depressed patients, I think the most common reason is side effects. Some people will have dryness, their mouth will be dry, they'll have constipation, they'll be sedated. And then also depressed people tend to be forgetful. They might have forgotten to fill their prescriptions. Some depressed people, they're actually too moralistic. They feel that being depressed is being weak, and they don't want to be depressed, they don't want to be ill, they don't want to take medication. They see it as a sign of weakness. But more schizophrenic patients stop medication than depressed patients. Again, depressed patients take antidepressants. There's sometimes an odd response to antidepressants. Some people, about 1 to 2% of people will develop suicidal thoughts from taking their medication. So if you see somebody who's depressed, they're saying they're suicidal and they've never been suicidal before, a tip is, did they just start an antidepressant recently? That can also happen with bipolar patients who are given antidepressants, and for a bipolar and antidepressants are much too activating. They'll actually increase the cycling, increase the energy, and then a bipolar person can become suicidal on antidepressants.